Hey there, it's Dr. Mitch with Fitness TX. This is for all my athletes that got beat up forearm, flexor mass, kind of medial epicondyle stuff going on in their forearms. You know who you are. This one's directed right to you. Any other CrossFit athletes or fitness athletes, especially when we do a lot of barbell work, pulling, horizontal pulling, vertical pulling, the flexor bundle of the forearm is going to get pretty trashed and pretty beat up. And it's easy for that to get really knotty tight, leaking into the elbow, or even some distal wrist pain. So this is one way that you can kind of get in there, get some tension on the flexor bundle, and actually start taking that wrist through some extension range of motion, trying to get some things to alleviate and clear up for you. So all I got is a barbell, a small box, a couple pads for my wrist to lay on. And what I'm going to do is just essentially get my forearm on the box so that my wrist can hang off the end of the box. I'm going to take the end of the barbell and just find a nice place in the flexor mass of the forearm. Now, where that flexor mass inserts is on the medial elbow here, on the inside portion of your elbow if your palm is facing away from you. And so where I'm trying to stay is right through this region here, working below the elbow crease to about midway down the forearm. So I'm going to find a nice area that feels tension. You'll feel it as you press the barbell in. There'll be a hot spot there you can find. What I'm going to do is start with the wrist up towards my nose, pin it down with a decent amount of pressure, and then slowly take the wrist through its extension range of motion. Reposition the barbell, up, down, left to right, pin it with the wrist up, slowly take the wrist through extension range of motion. Play around with that, rolling the barbell down the wrist as you go, taking the wrist from flexion, trying to get full extension out of the wrist as you go. Again, you'll find different hot spots depending on where you're at. Only put as much pressure as you can tolerate, and you can still take a deep breath in and out. If you're pressing down so hard that you're holding your breath, just trying to survive the mobilization isn't having the effect that you want it to have. So less is more when in doubt. Be able to tolerate it, as much pressure as you can hold, and then take the wrist through its full range of motion while you're still taking a full breath in and out. That's a little flexor mass forearm smash for you. Use a barbell. You can spice it up with kettlebell if you'd like. Let me know how that goes for you.